Excellent. It is wonderful, wonderful to have you all while we're getting settled down. Everybody put their feet on the ground, loosen up their shoulders, just be happy to be in a group with a bunch of other people, like-minded people who are doing the same work we're doing. We are so excited to have everyone here tonight and to have our friends from SisterSong joining us. And excited to have everyone also on the call from PNHP, get to know them a little. Um, you know, we've been talking about how since January, our public health and research infrastructure is being taken down, dismantled, the different pieces overtaken by ignorant, profit driven quackery, racist, sexist, supremacy culture influencing the kinds of research studies that can take place. And it's worth remembering this has been part of reproductive and women's health care from its beginning. You all are going to be hearing some of the history of it, but think about how recently we've heard about forced sterilizations at ICE detention centers, and think about OBGYNs being mandated by law to provide misinformation to their patients about abortion, right? Government mandated lying. Um, and then we were talking before you all joined us about this Supreme Court decision today, essentially allowing states to deny Medicaid recipients access to health care. I'm going to quote, I don't read quotes. Give me a second to find it. Oh, here it is. Justice Jackson, right? A like-minded, we like to think, who is on the Supreme Court, said today's decision is likely to result in tangible harm to real people. At a minimum, it will deprive Medicaid recipients in South Carolina of their only meaningful way of enforcing a right that Congress has expressly granted to them. And more concretely, it will strip those South Carolinians and countless other Medicaid recipients around the country of a deeply personal freedom, the ability to decide who treats us at our most vulnerable. She's out there as a voice too. It was a tough decision. And again, right, that's why we're here tonight among friends doing the work we need to do, building partnerships to overcome these partners. I am not going to feel comfortable defining SisterSong other than to say they are like minded souls and they are going to talk about themselves. Um, I'm excited at all the PNHP members who are here to learn about the work the Repro Justice and Repro Health Member Interest Group has been doing. And I'm going to use the term MIG. People always ask in the chat, what's she talking about? Member Interest Group is a MIG. And so just real quickly tonight, we're going to hear one of our MIG members talk about the context of reproductive justice in single payer and why we think it's an important piece of PNHP. We're going to let SisterSong talk about their mission and what brought them to this conversation. And then Ashley is going to talk a little bit about partnership building and growing, and hopefully some messages and learnings you can take from this conversation. And I'm just going to real quick, starting with Simran, if you'll then hand it over to do intros of all our speakers tonight, to introduce yourself to the group.
Absolutely. Hey everyone, my name is Simran. I am the National Membership Coordinator at SisterSong Women of Color Reproductive Justice Collective. I have been with SisterSong for about 4 years now, but I actually started as an intern back in 2019. So I'm very grateful to have gotten to grow with SisterSong's work. And I'm very happy to be here with you today. This partnership kind of started from a membership connection. So the membership program is really, we'll talk about it more at the end, but has really been able to create these fruitful connections. I am also an abortion doula outside of my work at SisterSong. I run abortion support groups in Raleigh, North Carolina. I live in Durham. And I use she, they pronouns. And I also I'm the host of the SisterSong podcast. So if anyone is interested in listening to that, I can put a link to that too.
And then you want to hand it over. I'll do
Oh,
naming. I'm
okay.
fine. I'll hand it over to Lauren. Let's introduce yourself.
Hello, everyone. My name's Lauren. I use she, her pronouns. I am a recent graduate from Cincinnati's med school. I'm now in Detroit, about to start my general surgery prelim year. Um, it's coming up. I was part of Students for National Health Program, now moving up in the world into PNHP. And yeah, I'm here to help out with the repro MIG kind of side of things and kind of describe why we are making this connection and allyship and why we think you should care too.
And Lori? Where are you? Lori Rodriguez. There you go.
Hey, thanks so much. So happy to be here. My name is Lori. I'm the education and advocacy coordinator with SisterSong. I too have been here for about 4 years, but I have a lot of experience working in the repro rights space. I worked for Planned Parenthood Federation of America. I also worked with Abortion Care Network, which organizes the independent abortion clinics in the country. Little known fact, but even before the overturn of Roe v. Wade, the trend was that most abortions and abortion care was actually done by independent clinics. 3 out of every 5 abortions were done in an independent clinic, not at a Planned Parenthood. So I think it's definitely just I guess my observations and my how I feel about tonight and what we're dealing, it's yes, it's a huge blow, but I think there's so many other places that aren't Planned Parenthood that are doing incredible work that you can continue to support. And I think it's important to highlight, especially in this moment when a brand like Planned Parenthood is being targeted so directly. But yeah, I do education things at SisterSong, and I also produce the podcast. So yeah, very happy to be here with y'all tonight.
Awesome. And then Shanti?
Hello, everyone. My name is Shanti Moore. I use she, her pronouns. I am based here in Atlanta, Georgia. I am also a new midwife, a doula, and the birth justice training and curriculum coordinator at SisterSong. And I'm glad to be here.
Awesome. Thank you. And Ashley?
Yeah, hi everyone. My name is can you hear me?
Mm-hmm.
Okay, perfect. Sorry, I got like a weird notification. My name's Ashley Douillon. I am a GYN oncology fellow. I use she, her pronouns. I've been involved with SNAP and PNHP for the last 10 years or so. I'm on the PNHP board now, and I'm very excited for the night that we have ahead of us.
Awesome. So Lauren, I'm going to lead us right into content. You're up.
All right, thank you very much. I am going to do the classic share my screen, ask if everyone can see it.
We can see it.
Perfect. We'll start here. Okay. I'm gonna get myself out of the way here. Okay. So the title of our call tonight is Medicare for All is Reproductive Justice. And as you know, it's the Repro MIG. That's sort of a subset of our PNHP membership. And we have SisterSong along for the ride here. So reproductive justice, sort of in a definition, which SisterSong was kind of the first to coin the term and sort of define what it is that we're talking about. So it is the human right to maintain personal bodily autonomy, have children and not have children, and parent the children that we do have in safe and sustainable communities. And so they go on to describe it as a human right, and it is much more about access, not just about choice, and is not only about abortion, which I know that that is a very focused topic right now, but it has much broader implications, as I'm sure many of you have seen. So why do we want you folks in PNHP to care about this? Why do we want other people that maybe aren't in PNHP to care about reproductive justice and single payer and realize why they're linked? We believe that they cannot be teased apart. These two and a lot of other things, really all tie in together. And I think it's important for us to like recognize that and embrace it. And that's kind of what we've been trying to do with these coalitions as well. So just sort of a background of PNHP, how we first started. It was really a single issue organization. They did not really want to kind of step out of the single payer universal healthcare lens. There was worry, I believe, that, it would detract from the main fight that we had. But somewhat more recently, I think this stance has been broadened. We've sort of realized and embraced that fact that single payer healthcare can't really be achieved without bringing in all of these other aspects of healthcare and social justice and things like that. So now we have a few currently member interest groups or MIGs, us in the reproductive health, reproductive justice. There's some infectious disease folks, peds, psychiatry. So just a little plug if you are interested and think, there's sort of a side organization or topic that you're particularly interested in tying into single payer, you can reach out to any one of us tonight and you can make your own MIG if you're interested. And just the kind of main focus of this call, and we'll talk more about this at the end, but really just building our base as single payer advocates. We want to bring in those people who are, we are all for reproductive justice, and we say, hey, that is relevant to universal healthcare. And so just bringing more folks into our intersectionality as well. Okay, so this is kind of a lot of words, but why Medicare for All and reproductive justice are so connected. It would enhance women's economic independence, which would be, kind of the main thing for women's health and women's liberation. And the Medicare for All Act of this year that just got put out and from previous years has always included language for like the comprehensive reproductive maternity and newborn care, and this year's also explicitly includes coverage of contraception, abortion, and assistive reproductive technology, which I think is very, very good that they're explicit about that now. And this is sort of a data slide. I know us doctors really like our data. And this just shows that healthcare coverage in the lens of Medicaid expansion is definitely shown to reduce maternal mortality, which is one of those main indices that we see in the reproductive space. And you can see that the non-expansion states had a very much more steep rise in their maternal mortality compared to our states that did expand their Medicaid. Just a little bit of background about how our healthcare system itself has sort of come to be. The history in the US has always been a racist and sexist and classist foundation, unfortunately, and that has really fueled the opposition to universal health care because of things like opposition to the Truman Plan, where they did not want to provide, people did not want to provide health care to non-whites, or taking our, Western fancy medicine and kind of pushing out the community carers like midwives and lay healers, and like the more traditional herbal indigenous medicine practices. And now we also hear things where we're trying to avoid coverage of undocumented immigrants. So it's always sort of been baked in the racism, the greed, the sexism. And there's, plenty of injustice and unethical care. Diljit kind of mentioned this and SisterSong will mention this as well, forced sterilization of women of color, contraception and sterilization as punishment, just an inadequate safety net for maternal and child health that we've seen throughout our healthcare system. And then also from the physician side, and like these Supreme Court decisions and things, the coverage and the legislation that is just eliminating physician autonomy and the physician-patient relationship and that trust. And if you haven't heard from a PNHP member about our moral injury survey, but this all adds up and adds to that moral injury that physicians and healthcare providers face. This is just a depiction of Dr. Sims. He was the father of gynecology, sorry. And this is an image of him and how he practiced just a lot of unethical practice of surgeries and procedures on enslaved women without anesthesia, and just how this is sort of paints the picture of what we have seen throughout our history. So any attempts to reform our healthcare system that has been baked in with medical racism and eugenics really needs to be able to confront that history, which is why reproductive justice is so important to single parent. So now we will hear from Lori and Simran from SisterSong. So I'm going to escape here and stop sharing. We will hear from them and what they have for us. I'm really excited.
Thanks, Lauren. Are you good, Laura? Laura, are you connected?
Yes, I am. Thanks so much,
Great.
Lauren. Let me pull up my screen so that I can share my slides. But yeah, that's a really good like groundwork and just like introduction to the like larger conversation of like how is reproductive justice like a part of like, you know, this single payer healthcare conversation. I think, and just before we dive into this conversation, I do want to start off my presentation with doing a land acknowledgement. So just a reminder that we are on occupied territory. I think it's, it behooves us to learn about the histories that existed before colonization, to acknowledge them and to really figure out ways forward with like genuinely acknowledging those histories. So I'm in New York City. I'm in Lenape-Hoking territory. Just to start off our conversation about, what reproductive justice is before we like talk about the history a little bit. It is a movement, and it's also a framework. So the reproductive justice framework is something that's based in the human rights framework. Loretta Ross, who was the first like executive director of SisterSong, really worked on putting this together as like a advocacy tool, as like an organizing tool. And she was very much inspired by work that she saw happening in the global South, where people were talking about their rights in relation to human rights. So really what the RJ framework is doing is it's centering the lived experiences of Black women. And I think that that's what makes this framework really like profound as well. So the first tenet of RJ is that every individual has the human right to decide if and when they will have a child and the conditions under which they will give birth. And overall, this framework is really about like ensuring that people have bodily autonomy. This is specifically through the framework of like birthing, and like reproduction, like raising children. But I think it's very important to center like the right to actually decide like if and when to have a child, because Black women have not always been in control of their own reproduction. I think that's a really profound insight to bring into this conversation. It's something that's really important to acknowledge. Because I think the most a recent and horrifying example we see of like the state deciding when someone will reproduce or when they won't is in the case of Adriana Smith, who is a nurse in Georgia who basically had a brain clot and ended up being that she went to the hospital, had a terrible headache. She couldn't get treated because she had an early pregnancy. The doctors refused to treat her. They sent her back home. She went home. She had a brain clot. She showed up at the hospital and they couldn't help her. She ended up being brain dead. And then she was kept alive. She was kept alive, functional, like, because she was brain dead, like she was deceased. Like her body was kept functional because she was pregnant. So literally, like the state decided to like incubate a fetus in like a corpse, which is just like, it's very disgusting. It's very brutal. Like SisterSong has been directly supporting the family, and they are getting like, you know, financial and emotional support, but it's like, it's a terrible thing. And like that is a very extreme example of like, oh, this is why the right for people to actually decide if and when to have children is like fundamental, because like the person carrying the pregnancy needs to be the one determining, you know, like if they want to be doing that or not. And the part about conditions under which they will give birth, that's really about making space for things like, you know, birth work, or, you know, like doulas, midwifery, having like, you know, at home births, really having like culturally competent, like supported birth that's like not necessarily in a hospital. Because there is also like there's a like complex history of how like the medicalization of birth pushed out like traditional like slash indigenous slash like, you know, community based birthing practices. So, you know, that is another, and SisterSong specifically is like pursuing this work through like our birth justice care fund and our birth justice program, which Shanti will speak about a little bit later. um the second tenet of RJ is that every individual has the human right to decide if they will not have a child and their options for preventing or ending a pregnancy. So this is where we talk about the right to abortion. What I think is really like special and like interesting about this is that like we talk about abortion without specifically naming it as such. I worked in abortion for most of my career. I think it's so important to like say it, destigmatize it, like really push back against like stigma. But at the same time, as an organizer, as a like person who works in like, you know, the communications field, I also know that it has been such a politicized like, and like such a like it has become such an intense topic and such a rallying point for so many people that like sometimes if you use that word it will shut people down. So I think it's so important to focus on like, hey, this is actually about someone's ability to like choose what to do with their lives. And I think it also places, you know, the abortion like conversation where it should be, which is in the greater context of like, hey, this is just a part of reproductive health care. Like, this is just one of the things we need to be talking about. Like, there's so much more that like goes into like the actual birthing process that is being totally disregarded by like focusing on abortion as like the like fundamental right. Um, Not to say that it isn't a right, because it is, but it's not the fundamental one. The third tenet of RJ, and I think this is where the framework goes further than the pro-choice movement, and it definitely goes further than the pro-life movement, is that we care about what happens when the children are actually born. So the third tenet is that every individual has the human right to parent the children they already have with the necessary social supports in safe environments and healthy communities, and without fear of violence from individuals or the state. I like the direct acknowledgement of fear of violence from the state. I think that is like a really important thing to talk about, especially, you know, in the context of like the histories and legacies of medicine, like medical racism, like eugenics, like even like the case that I talked about that like happened literally like, you know, within the last week in Georgia. Like that is an instance of like state-based violence, you know, acting on someone's reproductive life. And you know, in with like a reproductive justice framework, when we have a conversation about like what it means to have reproductive rights, it's also a conversation about what it means to raise families in safe, healthy, sustainable ways. And ultimately, this framework can really be summed up as like bodily autonomy free from all forms of reproductive oppression. This fourth tenet was explicitly added by Monica Simpson to like really just address and like include explicitly queer and trans people. Obviously, this larger framework is about bodily autonomy at large, but like in the repro space, like I think we can center a lot on like women and like, you know, like womb center talk because we are talking about birthing. But you know, we know that birthing people like are not necessarily women. There's like a, you know, gender diversity in terms of like who's birthing. And then also like the process of like raising a child, it's not something that just women do. So we want to make space for queer, trans people, like people of all gender expressions, and to really like affirm gender expression as a form of bodily autonomy. Same thing with like, you know, choosing when to have a child and how to have a child. That is a form of bodily autonomy. So to get into the conversation about like, you know, what does SisterSong think about universal health care? Like, what is the conversation that is like, you know, that has happened or is present? Um, SisterSong actually began as a direct response to like past healthcare reform legislation. It was in attempts to actually like change legislation around how many people were being covered. So this is a photo from the March for Women's Lives in 1989. So SisterSong specifically got started in 1994. There was a pro-choice conference. There were 12 Black women who, and at this conference, one of the things that was being talked about was the 1993 Clinton administration's healthcare reform proposal. And the Clinton proposal did include coverage for abortion care, but it didn't cover the full range of reproductive health care services. So like prenatal care, contraception, and screening for and treatment for cancer, STDs, and HIV/AIDS. And basically these 12 Black women, like they formed a breakout group. They talked about it. They were like, you know, we need to push back on this in some way, shape, or form because like we don't endorse this. Like we need to push for more from healthcare reform. Because like, you know, like that's the only way our like concerns and voices are going to be heard. And they formed this group, the Women of African Descent for Reproductive Justice, and their healthcare reform message. It also included advocacy for strong protections from medical racism and eugenics. Because again, if we're centering the perspectives of Black women using RJ, what we know is that like medical racism and eugenics are rampant. So if we're going to have any conversation about reforming healthcare or like increasing the coverage of people, you know, people covered under healthcare, like we can't have that absent of conversations about how we like acknowledge that past. And you know, even just beyond like a like even just the beyond like let's confront the way that like the medical system is directly engaging in like medical racism and eugenics. Like there's also like conversations about like healing that needs to happen. Like there's a lack of like patient trust with like doctors, for example, because of like cultural reasons, because of like histories of like medical experimentation and uninformed consent. And you know, we can't like talk about like what it looks like to have like a nationally implemented healthcare program without being able to like, you know, deal with those cultural issues of like what prevents people from getting healthcare in the first place. So this right here is a image because those 12 Black women, they bought a full page ad in the Washington Post. Basically, it was a letter to Congress saying like, hey, this is what we think needs to change. They got a bunch of like friends and supporters to sign on at the bottom. And that has been, you know, like really SisterSong like has been tackling and dealing with this issue since its inception. Yeah, and you know, the two big takeaways again, in the repro space, are that medicine in the United States is really deeply entangled with histories of medical racism, and that we need to engage those histories. So this is a picture that was shown earlier. This is J. Marion Sims. He was he's known as the father of modern gynecology. He was like the president of the American Medical Association. He was actually part of he was the president while like birth was being medicalized and like midwives and doulas were being pushed out of the birthing space, which I think is very telling. But also he like developed surgical techniques like the C-section, and he developed this by like operating on Black women who were not under any anesthesia. So he was, you know, basically using them as like test subjects. And I think it's like, you know, it's very telling that like, you know, the father of modern gynecology is like in the United States at least not only like medicalized birth but also like experimented on Black women. So like, you know, those are histories that we are dealing with, and specifically through the birth justice program, like we really do want to increase the amount of like culturally competent care that people are like able to get. And like one of the things we're always thinking about is like, how do we put this care back into community knowledge, into community hands? Because at various points in human history, they have been community-centered practices. So like, what does it mean to make it community-centered again? You know, and then in Repro, the other like the eugenics conversation is about how the United States has historically sterilized populations it deems unfavorable or unworthy. And you know, this is something that primarily Black, Indigenous, disabled, queer people have experienced, but poor people have also experienced it. So it has been the case that like with eugenics, it was initially like poor white people who, especially poor white men who were like repeat like criminal justice offenders or like had repeated like interactions with the criminal justice system. The eugenics got its start because the thinking was like, oh, we should just like castrate those guys so that they can't reproduce and like, you know, like continue their like bad lineages. And like that is a mindset that the US just kind of like approaches a lot of things too, like subtly, like kind of like the survival of the fittest, like you have to like be the absolute best, like otherwise you like don't deserve like basic, you know, services. So, you know, again, at the most extreme point, we see like cases of like government, like state mandated, like forced sterilization. These are the Ralph sisters who were sterilized at 12 and 14. Their mother was illiterate. They were sharecroppers in Alabama who like moved to a city after industrialization, like, you know, like put them out of jobs basically. And this was very recently. This was in 1974 that they were forcibly sterilized by the state. But basically, like some social worker came to their house, like made a determination that like they were not fit to reproduce, and like the state deceived their mother into signing forms that like where they got sterilized at 12 and 14. So you know, these are also like the deeper conversations we need to be having. It's like what kind of systems, like say like you know, like the like child protective services, like what is their role in like maintaining like these terrible health outcomes, and like really how does the like way that our healthcare system is like used as a system of control, how it like collaborates with like, you know, like again, like child protective services, like systems that are like interact directly with the law, like we have to look into those spaces like as like also like, oh, these are places that we need to look into, and like really like is that how medicine should be used. You know, so outside of that, like US medicine, just like things that like I'm sure that like y'all talk about, like, but that like you know, the repro justice conversation really brings to the forefront is that like, you know, American, like Western, industrialized medicine, it also has a very patriarchal focus. So women were largely included from clinical trials in the 20th century. So, you know, as far as like science-based, like we do need some data like that we just weren't collecting. And this kind of like lack of like research focus, like like time and money like put into topics, it looks like a lack of research about PCOS, like a polycystic ovarian syndrome. It looks like a lack of research about endometriosis. And at a larger, like framework, it looks like the larger dismantling of abortion, and by extent, and not only the dismantling, but the criminalization of abortion and OBGYN care. So, it's like these are going to have like these are these the way that healthcare is being dismantled in these ways is going to have impacts for all of society. So it's, also very important to talk about like, no, it's not just like a like afterthought to include women. Like that is absolutely central to like how we approach medicine. So, the United States is the only wealthy nation that hasn't adopted some form of universal health care. And if we want to look at like just what the numbers are for like having universal health care coverage like nationwide, um, so the proposed Medicare for All Act, and this is a study from 2020, it would save 6,800 lives and $450 billion in national healthcare expenditure annually. So the bottom line is that like, of course, there's different ways that like these systems are implemented and paid for. But at the end of the day, if you have more healthcare coverage that's more accessible for more of your population, overall, like the health of the population increases and the costs of healthcare decrease. And really, like a lot of the reason that we don't have universal healthcare in this country is that we are deeply ideologically opposed to universal healthcare. This is really, really directly related to a history of slavery, to a history of white supremacy, to a history of, chattel slavery evolving into capitalism, evolving into like, economic exploitation. And the kind of like ideologies that normalize that in the United States very much say like, oh, like only certain people are deserving of like care. And I think that like that is such an important thing to push back against. And someone mentioned this earlier, like with the like victory of like or like the victory of Zoran for like, like the Democratic ticket for New York mayor. I think that there's been a lot of fear with like talking about like, socially funded like welfare systems that like might be termed socialism or communism or what have you. But I think that a lot of the fear is also very based on propaganda, because if what we look at like what people want to talk about, what people want, like people know that like their healthcare systems are exploitative. So I think it like people do want to think about like, all right, what does it look like to like actually like have a society that like doesn't exploit me at every turn. And specifically again in the repro space, the way that we see this lack of healthcare playing out in like just the maternal mortality rate is that the United States has the highest maternal mortality rate of any developed country. And for Black women, this rate is anywhere from 3 to 4 times higher than it is for white women. But I think it's really important to note that even for white women, the rate of maternal mortality is higher than it would be in another country. So I think this is very indicative to like racism doesn't just hurt Black and brown and indigenous people, it also hurts white people. And factors that play into the high maternal mortality rate include uninsured and underinsured patients, the inaccessibility of affordable care before, during, and after pregnancy, and a lack of patient-centered, holistic, and culturally competent care. So I'm going to pass it to Shanti now, who is our birth justice person, and she's just going to walk you through some more like focus things on the birthing side.
Thank you, Lori. So I just want to paint a very simple clinical picture to make the connection between the lack of access to insurance and how that contributes to maternal mortality rates. So we know that a lack of insurance in pregnancy can lead to fewer prenatal care visits, which can lead to issues like low birth weight, infant mortality, early deliveries, and pregnancy complications. And Lori, if you will advance to the next slide, please. And so, for the purpose of this portion, I just want to ask a question and feel free to drop your answers in the chat, but I'd like to know.
Shanti, can you pause really quick? Sorry, I'm having technical difficulties.
Sure.
Okay, there we go.
Okay. So, you can drop it in the chat. Just what percentage of birthing people do you think conceive pregnancies without insurance? I see 10%. Any other answers? Any guesses? I saw 70, I saw 40, 60, 19, all over the place. Thank you for your participation. So, according to a 2018 Medicaid briefing, 1 in 5 women and birthing people were uninsured the month prior to conceiving. So, about 20% of people conceive pregnancies without being insured. And while the federal government mandates that state Medicaid programs provide coverage for prenatal care and for labor and delivery services, it doesn't include preconception care, which is really important as well. So roughly 50% of birthing people begin pregnancy with inadequate iron stores. And considering that there is a physiological anemia that occurs naturally in pregnancy, starting out with low iron stores can introduce risk for serious complications. Iron deficiency anemia is also an underlying factor associated with poor maternal and infant health outcomes and increases the risk for things like preterm birth, low birth weight, maternal and fetal complications, postpartum hemorrhage, and maternal death. And second only to mental health conditions, postpartum hemorrhage is one of the leading causes of maternal mortality in the US. And the impact of maternal loss is far reaching, often having detrimental effects on the economics, education, and health of the families and children left behind. But just think about the risks that could be mitigated if people had access to preconceptive care. Being able to have something as simple as an anemia panel to assess someone's state prior to pregnancy can make a difference in whether or not they have healthier outcomes. And just to provide even a little bit more context, I was doing some research and preparation and just happened to look up a freestanding lab. In my area, one of those labs where anyone can walk in and basically purchase out of pocket a laboratory test that they would like. And an anemia panel out of pocket was $299. So just imagine if you're someone who's in that preconception period and you are doing the work to grow your family, just to check your ferritin levels, basically your iron levels, that's a $300 cost out of pocket. And then imagine if you did discover that you were iron deficiency anemic and you needed to supplement, then there's another cost on top of that after supplementation just to check to see where your levels are. So I wanted to also just talk about some of the ways that Sister Song's birth justice programming addresses the issues of maternal mortality and morbidity. So we know that studies have shown that birthing people who receive doula support are 68% less likely to have a cesarean delivery. And we also know that breast and body feeding has been shown to provide a range of benefits to both mother and baby. And we also know, unfortunately, that suicide is a leading cause of death during the perinatal period. And the reason why I am mentioning these things is because these are some of the reasons why our birth justice team has created programming like our Birth Justice Care Fund, which provides access to doula support, lactation consultants, and maternal mental health therapists to Black and Brown people who identify as trans and non-binary, teens, those who are unhoused, people with refugee status, people who are disabled, and others who are from some of the most marginalized communities. One of the other programs that we facilitate is called We Outside, which is a seasonal series that focuses on education about perinatal nutrition and exercise. And this idea was actually born out of my lived experience of having recently completed my degree in nurse midwifery. I noticed during my clinical rotations in a handful of different clinical environments that nutrition and exercise was usually touched on during that initial prenatal visit, but rarely expounded upon unless there was an issue that was linked to nutrition. And I also recognize that this was an issue because one, adequate nutrition and exercise is foundational to a healthy pregnancy and birth. And two, many of the causes of maternal mortality and morbidity have nutritional links. So these programs are just two examples of the ways that we at SisterSong are working to address the issues of maternal mortality and morbidity in Black and Brown communities. And we are also deeply involved in advocating for abortion, fertility, and midwifery care access on the state legislative level. And lastly, I'm just going to add this. This is personally from my heart. I really do feel like practicing healthcare from a reproductive justice lens is largely about listening to, hearing, and amplifying the voices and centering the needs of the patients and the clients that we serve from the most marginalized communities. And I will turn it over to whomever's next.
Thank you so much, Lori and Shanti. Ashley, I think you're up.
Yes. Lauren, do you mind sharing our slides again? While we're working on that, I just want to say again, thank you so much, Lori, Shanti, Simran. Such an excellent presentation. We're so appreciative of you and really all of your effort and attention that's gone into this and really continuing to work together in our partnership. So I want to take the last few minutes of this call to discuss in a little bit more granular detail of what the process of developing this partnership looked like. At the hope that you can apply this to where you are locally. So really to start, the Reproductive Justice Member Interest Group started as a common interest and a vision amongst myself, Diljit, and Judy Alpert, who's another OBGYN, that organically led to the formation of this as a member interest group. And so on this slide is our mission statement that we wrote together. And we read this at the beginning of all of our meetings to really center our work and make sure that, we're moving forward with a focused purpose. In the 3 years since our inception, we've been able to successfully launch multiple ongoing projects and efforts, two of which I want to specifically highlight tonight. Lauren, you can go to the next slide. So we are incredibly lucky to have a number of wonderful, hardworking, amazing organizer students within our MIG. They have specifically started working on a writing campaign to get the word out about the link between reproductive justice advocacy and universal healthcare advocacy to physicians and the general public alike. And then in addition to this, one of our main focuses in our group is organizing within ACOG, which is the American College of Obstetricians and Gynecologists, essentially our OBGYN national society and representative within the AMA. Really our goal with this is through education, discussions with ACOG members that already may be supportive of PNHP, but don't really know that we exist. We're hoping to continue to build our base and develop more of a presence within ACOG. So some of the things we're working on is a session proposal for the upcoming annual meeting, and we're going to be working on that on a regional level throughout the upcoming year as well. And then in addition to that, we're constantly thinking about how can we further expand our reach and grow our partnership with other allied organizations that are doing the same work or have some of the same shared values that we do within PNHP in the same way that we decided to work with SisterSong. So as a little plug, anyone in this call, I hope that you have at least some baseline interest in why reproductive justice is important. And if you're really interested in working on that intersection of reproductive justice and universal health care, I do encourage you to join us at our next meeting at the MIG. I'm hoping that Rebecca or Lori can put that information in the chat. Lauren, you can go to the next slide. And so finally, again, I wanted to touch on what it looked like for us to develop this partnership. And this is kind of at the fear of it seeming very self-explanatory. Like some of these things may seem kind of obvious, but I think it's helpful to just talk through how we actually went about this. So when we started working together as a MIG, we did some brainstorming thinking about where we wanted to build partnership. And that's a great place to start. Just thinking about, and really if you're within your local chapter, thinking about what are some of the local organizations that have aligned values and may be doing similar work or work that aligns very closely with what we do within PNHP. So Dojeet had suggested SisterSong and reached out to Simran. And since then, there have been several meetings between all of us that have involved us learning more about each other as organizations, some of our values, and how we could mutually benefit one another. And I think that's a key point when we're thinking about coalition building, is that not only should you be thinking about building a partnership for the purpose of further building our base, but it's really important to think about how can we also support what their organization is doing. And so, our work with SisterSong started with Simran speaking at our reproductive justice workshop at the annual meeting back in 2023, I believe, and has since evolved to us presenting a similar educational session to their membership in January, and then to this conversation today. So again, the final thing I want to point out is if you are going to do this on the local level, in order to do this and further build your base, I think it's important to have a strong foundation to start from. So that means if you don't already have a strong chapter, I would focus more of your energy in building your chapter and your presence and power before you start doing this kind of ally work and coalition building work. That way, whenever you are approaching an organization or a group about building this kind of partnership, you have the people power to really back it up and show up for their organization just as you would want them to do for ours. You can go to the next slide. And so I think a good example of this is what our team with the New York Metro chapter has been able to do. We've really been able to build solid, strong partnerships within the New York Metro area that are all listed on this slide. But this is not something that happened overnight. This has been years and years of work that, our executive director, Morgan Moore, and all of the people that have been a part of our chapter in New York Metro have been working on. And again, we've been able to maintain these relationships by showing up and supporting when we're called upon, and being able to, do what we need to do to help support our partners. So I'm really hoping that everything you learned today has been enlightening, inspiring to think about where and with whom you can start to form coalition with. And then before moving into any questions and answers, we want to cover just a few action items to leave you with. And so for that, I will turn it over to Simran.
Awesome. Thank you, Ashley. And thank you everyone for being here. Some potential ways that you can get tapped into the work that we are doing. You can support the Birth Justice Care Fund. So that is our direct action, direct mutual aid fund that we do. And so that was actually created in 2020 when the COVID outbreak happened, and there was a lot of fear about giving birth in hospitals. And I think that's something that's true outside of COVID, but was notably true during that time. And so we wanted to create a resource that was going to provide this pool of money, pool of access for resources for people to be able to get to. And originally the idea was to be able to provide people with doulas and midwives that they could work with. And then there was this realization that, actually a lot of people in the community had doulas that they wanted to work with, or had midwives that they wanted to work with. And what would actually be more effective and more of aligning with our reproductive justice goals is being able to give people money to pay the doulas that are in their communities that they want to work with, and give them access to diapers and wipes and strollers and all of those things. And so people can apply for the Birth Justice Care Fund. I believe it's in Georgia, North Carolina, Kentucky, and Florida. Somebody else can correct me if I'm wrong on that, but am I right, Shanti?
That's correct. You're right.
Yes. Okay, great. And focuses on marginalized communities. I'm going to put a link to be able to donate to that care fund in the chat. And then the other thing is that you can join, I don't know if that, yeah, that worked. Join PNHP. I know that I sent this meeting out to some of our SisterSong people. So if there's anyone from SisterSong here, you can join PNHP. As far as I know, you can join even if you're not a physician or not in medicine, right? Okay, so
Yes,
if you're interested in getting involved with any sort of the universal healthcare movement and the intersection of reproductive justice, definitely get involved in PNHP. And if you are a PNHP person and want to get involved in SisterSong, we do have a membership program, which is a really great way to stay connected with the work that we're doing. I just put the link in the chat, as well as support us and also just really stay tapped in. So there's a lot of cool work that's moving all the time. And so yeah, if you want to get involved, it's a great way to get involved. And then plugging into your local organization. So there are abortion funds or independent abortion clinics in your area. There are ways to do clinic escorting. You can do donations, but you can also do, if donations isn't the way forward, you can do transportation, childcare, housing for people who are getting abortions or potentially have to go across state lines to get abortions. There's so many opportunities to tap in, money or otherwise. And there are also birthing centers in your area or doula and midwife collectives. It's not just about the abortion conversation. I am also going to plug the podcast that we have. I'm going to send a link to that. If you want to learn more about the intersections of reproductive justice and other movements, it's a fun podcast, has a silly name, but it focuses on the intersection of all kinds of different topics, environmental justice, birth justice, all these things and how they impact reproductive justice.
Yeah, it's an amazing podcast. Would recommend.
hilarious.
I want to also just plug, so I know, this has been an ongoing conversation. Medicaid is under attack in this country. So we have created a tool to easily connect you with your representatives, so that you can reach out and use your voice to continue to fight back against the cuts. As we have highlighted throughout the call, cutting Medicaid, cutting healthcare is an issue of reproductive justice and will lead to worsened maternal morbidity and mortality. Please call your representatives, call again, continue to fight back. But we're right at time. I don't see any questions in the chat. If anyone has any, please feel free to send them. I really want to again thank everyone so much for being here. I'm going to turn it over to Diljit, though, to do our formal good nights for the evening.
That was a great
I
good
realized I was
night.
launching into it and I didn't want to take your job.
It's all good. No. I'll share my job. I'm a good delegator. But thank you to everyone who's here. Thank you to our awesome staff who supported us. Mandy, Lori, Dixon, Matt, trying to think who else was on. And Rebecca and Anika, of course, who are integral. Rebecca keeps Repro MIG working. And then thank you to everyone who came tonight. Thank you for all you do. Know that we are all here, and reach out to me and Ashley and Lauren and Rebecca within PNHP. We can always keep everyone connected. Thank you again to SisterSong for all of the essential, wonderful work you do and for coming tonight. Appreciate you so much. Good night.